Hey everyone, this is Dr. Mitchell here, sitting in traffic in cloudy Arizona. It was a beautiful day, got some climbing done. Just wanted to share a case with you that I thought was really interesting, that highlights a lot of really neat principles and tidbits that'll give you some information and help you sort things out. So, 70-year-old woman comes into the clinic with joint pain in both of her hands, small joints, okay? It looks like osteoarthritis to me. Ran some lab work, went through like 200 pages of records, and found out that there's a lot more to the story than meets this eye. Okay, so the arthritis in her hands, she looks like more osteoarthritis, and she's got these nodules in her knuckles closest to her fingernails, and that's typically characteristic of osteoarthritis, but you can have other types of joint disease like psoriatic arthritis, and in rare cases rheumatoid affect those joints. But really, when something more autoimmune is going on, we suspect the joint's closer to your wrists. So that's your PIPs, and then your MCPs, which are those big knuckles that you might punch somebody in the face with. So going through the records, she saw a rheumatologist who said to her that she had lupus, and that if you don't take this Plaquenil, you're going to die. So she refused. She thought this clinician was crazy, talked to a bunch of other clinicians who thought she was crazy, and, thought that she had nothing more going on than degenerative arthritis. But the plot thickens. So the lab work came back, and she had a positive rheumatoid factor. And going through her records, she's had a persistently elevated rheumatoid factor for a long time. Rheumatoid factor, some of you might jump up and down and say rheumatoid arthritis, but rheumatoid factor is a non-specific marker for not just rheumatoid arthritis, but a lot of other autoimmune diseases. It pops up in multiple autoimmune diseases. So sensitive, but not specific. Not terribly sensitive, actually. But, so she's got that going on. She had Raynaud's when she was a kid. Raynaud's, there's primary, and then there's secondary. So secondary, usually due to autoimmune diseases, most commonly scleroderma. And, I'm getting stopped at a light here. God damn it. But really, any other autoimmune disease, rheumatoid arthritis, lupus, psoriatic arthritis, Hashimoto's, all these things can present with Raynaud's. It doesn't discriminate. This flavor likes all autoimmune diseases. So she's got the Raynaud's, she's got the persistently elevated rheumatoid factor, sulfa sensitivity. Always really interesting. And I missed this, her first visit when she came in. I didn't have that documented the second time I saw her, and I was like, what the heck happened? And I didn't do a good job of probing deep enough. But anyway, that's irrelevant. Sulfa sensitivity is really, really common in patients with autoimmune disease, more specifically lupus. Don't ask me why. I have no idea why. But I always ask family history when I hear about sulfa sensitivity, and invariably somebody mentions a relative with arthritis or lupus. So really, really interesting. Low thyroid in her 20s. She was treated with levothyroxine for a short period of time for hypothyroidism unspecified, which she was labeled with. And if you are a woman in a developed country and you have a thyroid condition, it's Hashimoto's until proven otherwise, whether the antibodies are there or not. You can have a entity called seronegative Hashimoto's, which is just the absence of the antibodies. And so whenever I hear thyroid disease in a woman, I'm thinking autoimmune. Okay? And by the way, if anybody's treating you and you're Hashimoto's, I thought somebody was honking at me. If anybody's treating you and you're Hashimoto's and the antibodies, they're doing a bad job. They're just treating numbers. Antibodies do not correlate with disease activity. So if that's happening, find a different clinician. They're treating numbers, they're not treating you. And then she had a pulmonary embolism that was kind of random, may have been associated with some dummy move by some other naturopath who was using hormones, put her on testosterone, hydrocortisone, estradiol, and progesterone. There's a lot of funny stuff happening out there with hormones. Just make sure your clinician's doing a good job and isn't giving you a one-page questionnaire that says, are you fatigued and low in energy, and are you losing hair? There's a lot more to it than that, and in this patient with this type of history, I would have definitely been a lot more conservative about use of any hormones. Okay, so she had this pulmonary embolism that was kind of random, maybe precipitated by that. So We've got this joint pain, which she's coming in with. I see nothing else really going on outside of a little bit of fatigue. She's got this persistently elevated rheumatoid factor. She had Raynaud's. She had low thyroid. She had sulfa sensitivity. She had this pulmonary embolism. All right, so that's a lot of mumbo jumbo that doesn't really fit into any specific category for an autoimmune disease. So what I told her was, you have osteoarthritis, and there may be a little bit of an overlap here with something undifferentiated. You know, maybe there's a rheumatoid arthritic component. We'll take some radiographs of your hands and monitor this well, and we can do some deeper investigation if you'd like. But things are kind of quiet right now. And so, yeah, a lot more to this story than just osteoarthritis. That crazy rheumatologist wasn't so crazy after all. Although I will say, the patient wasn't going to die if she didn't have Plaquenil. So maybe she was crazy in that sense. I've actually talked to this DO, and she's actually a very nice woman. So good job to her. Okay, and oh, by the way, this is one of the most amazing women walking the planet. This patient of mine, she's just so sweet. Single mom, worked 3 jobs, raised 2 kids out of her car. One's a lawyer, one's a physician assistant. Really amazing woman. And so, you know, it really you can do anything you put your mind to. And I'm so blessed to have met this woman. But really interesting case, and a lot of tidbits in there that I think will help a lot of you out there dealing with bizarre health issues understand and sort things out better between you and your clinician. Because remember, it's a team sport, and really the moral of this story is you got to look at the history throughout life and look for all of these little clues. Because if you don't, and you're just looking at what's coming in the office, which unfortunately happens a lot in this day and age, things are going to be missed, okay? And in this case, you know, there's just a little bit of arthritis and some fatigue, and so, but we do want to be vigilant and keep an eye on things. So anyway, this is Dr. Mitchell signing off. I hope you guys have a good rest of your weekend, and we'll talk again real soon. Bye-bye.